So I know what a lot of people are thinking. Acupuncture, really? Tiny needles that are going to fix nerve damage that years of medication, physical therapy, or even surgery couldn't help? And I get it. Coming from Western medicine, I genuinely do. Before I spent years of working with patients with peripheral neuropathy, I would have had the same question. So today, I'm not going to ask you to take anything on faith. I'm going to walk you through the actual physiology, what acupuncture does to nerve tissue at a cellular level, why the combination of acupuncture with ATP Resonance BioTherapy creates a response that neither can achieve alone, and why the way we treat neuropathy is structured the way it is, because the timeline isn't arbitrary. It follows biology. There's a pattern. By the end of this episode, you're going to understand the science behind what we do well enough to explain it to your own doctor. And that understanding, I found, is what often gives patients the confidence to finally commit and trust a different path. Hi, I'm Dr. Rebecca Gibbons, acupuncture physician and registered nurse, and this is episode 4 of Neuropathy Series. So, let's talk about the physiological foundation or the science behind the treatments. We need to discuss the why before the what. So before we talk about how we treat neuropathy, I want to revisit something we touched on in episode 3, because it's the foundation everything else builds on. Peripheral nerve tissue has the capacity to regenerate. It can regenerate. This is a biological fact that gets lost in the conversation around neuropathy, where the dominant message is often just manage it, live with it. Nerves can and do repair themselves under the right conditions. The key phrase is under the right conditions, because nerve tissue is uniquely demanding when it comes to healing. It requires 3 things above almost everything else. So what peripheral nerve tissue needs to regenerate? 1, microcirculation. So this is consistent blood flow through the tiny vessels that supply the nerves with oxygen and nutrients. Without this, the nerve is being starved, just like your lungs without oxygen. The second is neural stimulation. It needs precise targeted signals to the nerve tissue that activate the body's own repair mechanisms, including the release of nerve growth factors and neuropeptides that support the myelin sheath regeneration, or the covering of the nerve. Our third thing we need is consistency over time. Nerve tissue regenerates at approximately 1 millimeter per day under ideal conditions. The nerves supplying your feet travel up to about 1 meter from the spinal cord. Meaningful recovery requires sustained, repeated therapeutic input over weeks, not just days. So standard neuropathy medications address none of these 3 things. Our treatment program, acupuncture, helps address all of them directly and systematically at the same time. So let me explain to you how. So let's talk about first acupuncture. And I want to go deeper than you've probably heard before, because the traditional explanation of acupuncture is usually explains in the words like qi, meridians, or energy pathways. It's one way of understanding a system that has been producing results for thousands of years. It's a 3,000-year-old medicine. But for patients who think in Western terms, the modern explanation is just as interesting. And for neuropathy specifically, the science is exciting, or at least I think so. When an acupuncture needle is inserted at a precise location, several things happen almost immediately at the tissue level. First, your vessels widen or vasodilate. The needle insertion triggers a release of vasoactive substances, including nitric oxide and calcitonin general-related peptide, that cause the blood vessels in the surrounding area to dilate. So more blood flows in. For nerve tissue that has been oxygen deprived due to damaged microcirculation, this is not a small thing. This is directly addressing the starvation that's been driving the deterioration of the nerve. Multiple studies have confirmed that acupuncture produces measurable increases in peripheral blood flow and microcirculation at and near the needle insertion sites. This is not a placebo effect. It is documented vascular response. So second, nerve growth factor release. Acupuncture has been shown to stimulate the production of nerve growth factor, or NGF, which is one of these key proteins that supports the survival, maintenance, and regeneration. So NGF is essentially a signaling molecule that tells the nervous system repair is needed right here. Grow and rebuild. So the third thing that happens is endorphin and neuropeptide release. The needle insertion triggers a cascade of body's own pain modulating chemicals. But here's the critical distinction from medication. There are not blocking pain signals coming from the nerve. They are part of an active healing response. The body is not chemically bypassed, it is actually engaging. The fourth thing that happens is, this is one particularly relevant for neuropathy. Acupuncture has been shown to modulate the activity of damaged nerve fibers directly, meaning in peripheral neuropathy, you often have a situation where some nerve fibers are overfiring, producing burning and pain, while the other ones are silent and they're producing numbness. Precise acupuncture point selection can help to recalibrate that dysregulation. So turning down what's overactive and waking up what's quiet. So it evens it out and it functions in the way it's supposed to. Now, so point selection really matters. It's not just generic acupuncture. The points we use for peripheral neuropathy are selected specifically to target the nerve pathways involved in the patient's symptoms, the vascular supply of those pathways, and the systemic factors, the inflammatory, immune, and metabolic factors that damage the nerve. Every treatment is individualized. That is a fundamental principle of how we practice. You didn't think that a little needle could do so much. So what does this feel like for the patients? Most patients are surprised about how comfortable acupuncture is. The needles are very thin, far finer than any injection needle, so you don't feel any pain or burning. You'll feel actually a slight poke and then maybe some heaviness, or you might not even feel it at all. Many patients that I have fall asleep or read a book or even look at their phone during treatment. So the second pillar of our neuropathy program is something most patients have never heard of. And it's one of the things that makes what we do at Acupuncture and Wellness of Pensacola generally different from a standard acupuncture clinic. So this is called ATP Resonance BioTherapy. And I want to take a few minutes to explain what it is and why we use it in the combination and during the same treatment as acupuncture, because the two work so well together and produce better results than if we treated it by themselves. So ATP Resonance BioTherapy is a painless technology that delivers low electrical frequencies. The ATP refers to adenosine triphosphate. It's like a gas station for your cells. It is the energy to the cells to function correctly. For cells to function and repair, regenerate, they need ATP, but damaged cells often have impaired ATP production. They are energy depleted, which slows or prevents the repair process from even happening. The resonance frequencies used in this therapy are selected to match the natural electrical frequencies of specific tissue types, in our case, nerve tissue and the surrounding vascular structures. When those frequencies are applied, they support the cell's ability to produce ATP, re-energizing the cellular environment and creating more favorable conditions for repair and regeneration. In practical terms, what does this mean? Reduce inflammation in and around the nerve tissue, improve improved cellular energy available for repair, giving the nerve cells the resources they need to repair the myelin sheath and restore the signal of your nerves so they communicate. Accelerated tissue response, when used alongside acupuncture, patients frequently report earlier and more consistent improvement than just acupuncture alone. So, no pain, no recovery time, no side effects. The treatment is applied through gentle contact electrodes, and most patients describe it simply as a mild warmth or tingling. So, the reason we combine both in the same session is that they address different parts of the same problem. So, acupuncture works from the outside in, stimulating vascular and neural responses through the peripheral nervous system. ATP Resonance BioTherapy works at the cellular level, supporting the energy environment that repair requires. Together, they create a therapeutic effect that is meaningful and greater than either if we did it alone. So I've been using the combination protocol for years now, and the results I see for neuropathy patients are consistently stronger than anything I've just achieved with acupuncture alone. Let's talk about another important pillar of our treatment. So it's the timeline. A lot of times I tell people 3 to 4 months, 12 to 16 weeks. Now that sounds like a long time, and I understand that because when you are suffering, you want results now or you want them overnight. So let me explain exactly why the program is structured the way it is, because it's important and it, again, follows biology. Peripheral nerves regenerate slowly. This is simply a physiological fact. The cells responsible for rebuilding the myelin sheath around your nerve fibers divide and repair at a rate that is measured in millimeters per day. Some of the nerve pathways we're working on travel a significant distance through your body. Think of from your low back to your feet and all the way up to your head. Full functional recovery of these pathways requires sustained, consistent therapeutic input over time. This is why frequency of treatment matters as much as duration. We typically see patients multiple times per week, especially in the early weeks of the program. This is where we establish the therapeutic response, improving the microcirculation, beginning to reduce neuroinflammation, and allowing the environment around the nerve to stabilize. Some patients notice early changes in sensation or sleep in this phase. Others during this phase don't feel very much, and that's completely normal. Healing is still happening. In phase 2, which is typically weeks 5 through 10, there's active regeneration. By this phase, most patients begin noticing consistent changes, reduce in burning, early return of sensation, improved balance, better sleep. The nerve tissue is actively responding, and is maintaining the frequency of sessions is most critical. Dropping off now would interrupt the regeneration process. In phase 3, which is usually 11 through 16 weeks, this is where it comes all together. Think of this phase as your body taking ownership of the recovery. The improvements you've been building start to feel permanent, not just good days here and there, but a new normal that your body is now sustaining on its own, which means we can start spacing out your sessions because you need us less, and that's exactly the goal. I want to see you a lot in the beginning, but not a lot towards month 4, 5, 6. So you may notice that you're walking the dog, sleeping better, feeling the ground underneath your feet. Your balance is a lot better. So a lot of my patients, they describe themselves as better than they've been in years. And this gives people a lot of hope. So the patients who do not get the results, let's talk about that. They hoped for almost always the ones who stopped. They come in maybe a few weeks. They come in sporadically here and there. They may gain, so they may have some gains, but then we also have some fallbacks, and it's just not as consistent. The patients who commit to the full program, who show up consistently, who trust the process, those are the patients who call me a year later and tell me they've hiked a trail they hadn't walked in years, or who tell me they slept through the night for the first time in decades. No two neuropathy cases are going to be identical, and no two treatment timelines are identical. Some patients begin experiencing meaningful improvement within the first 2 to 3 weeks. Others take a little bit longer, and there's many different factors to that I discuss with you as well. What we can say with confidence is that the body's capacity to heal peripheral nerve tissue is greater than most patients have been led to believe. You don't have to just manage it or live with it. And then one other thing I want to mention is, because it's a part of what makes our program different, we look at the whole patient, not just the feet, not just the nerves, not just the hands. So if you have diabetic neuropathy, blood sugar management is part of the conversation. If nutritional deficiencies are contributing, we address those. If there's a low back issue, we also want to address the source that's going to the feet. Same with the inflammation. If the inflammation load is high, we want to have a conversation about what could be causing that. So nerve tissue doesn't heal just in isolation. It heals as a part of an interconnected system, and our approach reflects that. I don't like to look at a patient as a one-size-fits-all. We are a practice that takes the time to understand each patient's specific situation and builds a program around that. So I know that's a lot of information, but if what I've described to you today sounds like something you want to explore, you can give us a call. I'll leave our information in the comments below. And every patient who walks through our door gets a thorough evaluation. I want to have a conversation with you, evaluate you, because you are not going to be the same as the other person that walks through our door who is suffering from peripheral neuropathy. So we commit to getting you the best result that this approach can produce. You can learn more about our neuropathy program at awpensacola.com, or to schedule a consult, you can give us a call at 850-530-1028. And in episode 5 of this series, we're going to walk through exactly what to expect in your first 4 weeks of treatment, week by week, because knowing what you're walking into matters. I know this is, again, a lot of information, but you can subscribe so you don't miss any future or past episodes. I'm Dr. Gibbons. Thank you for being here and giving me your time, and I'll see you in episode 5.